Good afternoon. This is Zimei from the 2nd Affiliate Hospital, Zhejiang University. It's my honor to share this breast case with all of you. Well, the reason I chose this case is because it's one of the reasons why I changed my study field from thyroid to breast 3 years ago, right? Let's see the case first. This 47 years old woman came to the clinic with a complaint of breast mass. The surgeon gave her a simple and fast physical examination and found a tough, flexible breast mass in her right breast. Nothing special was found. The lesion size was about 3 times 2 centimeters, and no nipple discharge, no tenderness, and just a history of breast hyperplasia. So it's time for ultrasound to work. Let's see the images. From here, we can see there was a hypoechoic irregular breast lesion at the 7 to 8 o'clock in the right breast with tiny microcalcifications. The color Doppler demonstrates a DL2 grade vessels. The elastography showed a moderate stiffness. The score might be 3, and the lymph nodes in axillae were all normal. So, according to this information, what's your diagnosis? For us, it was classified as virus 4B category, and it's non-mass-like lesion in the right breast. So the case was the contrast-enhanced ultrasound was suggested. Let's see the dynamic images. The contrast features including wash-in, hyper-enhancement, heterogeneous enhancement, and enlargement. Let's take one more look at the images again. At the first beginning, a quick wash-in, hyper-enhancement, heterogeneous enhancement, and the lesion size in the contrast enhanced pattern was much larger than that of the conventional ultrasound. So, according to this information above, what's your diagnosis? Again, does the second look from the contrast pattern of the ultrasound and help? For us, it do give us strong confidence, so it was upgraded to virus 4C. In the consideration of the burden of breast cancer, nowadays multiple imaging technologies was used to evaluate the breast lesions, including, we said before, the ultrasonography, mammography, MRI, and so on. So for this patient, the mammography showed a D-type breast, which means dense breast, common in Chinese women. And no defined nodules were found, just some circular calcifications right here, here, and here, which were diagnosed as benign calcifications virus 2 category. Also, the MRI showed D-type with an even signal and a type 1 enhancement curve after enhancement, which was also diagnosed as benign lesion and virus 3 category. So, that's the moment the patient and the surgeon had to deal with a problem. Which means that the inconsistent results from different tests. Well, we know that if there was imaging result suggested positive, so the biopsy should be suggested. 1 week later, the biopsy result came out and turned out to be a benign lesion, the fibroadenoma. It's definitely a sound slap on our face. Yeah. However, it's a good news to the patient, right? So the doctor told her to relax and just had a 3 months follow-up. Yeah. Then 3 months later, she came back for her subsequent visit with a swelling lump consciously. Besides, there was nipple discharge, bloody. All of us know that nipple discharge was not a good sign, especially with blood. So let's check the differences between these two mammographies. We can see here there were many calcifications right here along the dot, which were not found in 3 months ago. Of course, she had the surgery at last. Yeah, the final pathology is breast cancer. Okay, that's the interesting part for this case. Of course, not for the patient. She must have suffered a lot. But for us, ultrasound detected the abnormal signs first, and then the CUS gave us the support information in the second look. So we know that all the guidelines from domestic and on board presented that CUS in breast cannot be recommended in clinic use. However, it's an active research field, and it do really give us some support information from the second look. That's all. Thank you.
Thank you, Dr. Linzi Mei, for your presentation. Now we would like to have Dr. Qin Jiale to comment, please.
Thank you for your story. Thank you for Professor Li give us an advice. We should focus on contrast enhanced ultrasound. So let's discuss contrast enhanced ultrasound.
Okay.
So my question is, that's why you should both guideline and recommendation figure out it is controversial for using contrast enhanced ultrasound in breast cancer. What do you think?
Well, as I said before, in the consideration of the burden of breast cancer, especially in the beginning of this year, 2021, and breast cancer replaced the lung cancer to become the first cancer, right? That means we still have much work to do with this disease. So, however, although it's not recommended, but I think as I said before, it's an active research field. So we need to pay more attention to it. That's my opinion. Thank you.
So what kind of cases you will choose to the contrast enhanced ultrasound?
Yeah, that's another reason. Yeah.
I have another question. Okay. What do you think this case is misdiagnosis at the first stage? What do you think why this case will be misdiagnosis? Because of biopsy results?
Thanks for this question. The surgeon did this biopsy guided by ultrasound. There are many reasons that's why I chose this case, because it's very interesting for me. Another reason is that as I said before, it's an NML, non-mass-like breast layer. From this case, we start to focus on NMLs we not before. I think the type of this breast cancer or disease is one of the reasons why it's misdiagnosed. Okay.
Okay, thank you.
Thank you.
Thanks, Dr. Qin Jiale and Dr. Linzi Mei. And